following video is meant to give you important information regarding the COVID-19 virus pandemic. A pandemic is an epidemic of disease that has spread across a large region, for instance, multiple countries, continents, or even worldwide. All cases of COVID-19 are dangerous, and even the so-called mild cases can still cause severe symptoms. The next level above mild is severe, and these patients need supplemental oxygen. Patients who are critical require a respirator, and many suffer lung and multi-organ failure, sometimes resulting in death. A person with COVID-19 can take 2 to 14 days to begin to show symptoms. Some infected with COVID-19 start with cold or flu-like symptoms, including fever and dry cough. Some start with gastrointestinal problems. Despite these other symptoms, COVID-19 mainly attacks the lungs. It targets and kills lung cells. Lung cells are what allows the victim to breathe. Increasing inflammation caused by COVID-19 can cause the lungs to fail completely, resulting in death, even while on a respirator. To avoid the spread of COVID-19, avoid those who show any signs of sickness. Cover your mouth when you cough or sneeze, and throw away the tissue. Avoid touching your eyes, nose, and mouth. Clean and disinfect frequently touched objects and surfaces. Stay home if you are sick, except to get medical care. Wash your hands frequently with soap and water for at least 20 seconds. Practice social distancing by staying home as much as possible. Eat at home as much as you can. Only leave home for essential trips like the grocery store or pharmacy. Avoid eating out at restaurants and don't order takeout. Do not attend social gatherings of any kind, even those that involve small groups. Avoid visiting relatives and friends, especially those with potentially weak or compromised immune systems. If you think you're sick, stay at home except to get medical care. Separate yourself from others in the house. Wear a mask if available. Cover your coughs and sneezes and throw away tissues. Clean your hands often and avoid sharing personal household items. If you need medical care, call the doctor or hospital to let them know you're coming. Don't just show up unannounced. Many of the world's drug makers are working on a COVID-19 stopping vaccine. Many of these efforts have not yet reached the human testing phase. The biggest risk of rushing a vaccine to market is called vaccine enhancement, in which the vaccine itself causes the virus to get stronger and more deadly instead of getting rid of it. This has happened with other vaccines in the past, and doctors want to avoid this with COVID-19. Scientists have said it may take 12 to 18 months to develop a safe vaccine, and the COVID-19 pandemic will not truly be over until a disease-stopping vaccine is developed, made widely available, and administered to the public. COVID-19 has impacted more than the health of the world. It has made large social, economic, and political impacts in many countries, including the USA. Governments are being asked to coordinate prevention efforts, support unemployed workers and their families, and prop up businesses as the world practices social distancing and stays at home with their ever more empty wallets in their pockets. It remains to be seen if the world's governments and its leaders can rise to the occasion, or if tragedy and chaotic conditions will arise. We must all do our part. We must all work together, use common sense, and act responsibly. We must also look to our leaders and demand their best efforts to think, to seek solutions, and act with compassion as we work together toward the end of this pandemic that marks this time in the world's history.